Hi there. All right, we'll go ahead and get started here. So thanks everyone for showing up on such a snowy day. But we're really happy to have Dr. Kyle Nagle here presenting for us today. I was fortunate enough to meet him doing some coverage for a soccer tournament, and we got talking about some of his Paralympic classification work that he's done. So for those of you that don't know him, he's over at Children's. He's pediatric sports medicine trained, and we often run into him at 6 a.m. on Wednesday mornings during sports conference over here. But we're happy to have him in the PM giving our grand rounds. So I'll let him take over, and hope everyone enjoys grand rounds.
Thanks, Chris, and thanks for everybody for having me here. And thanks for braving the cold and the snow to get out here. I like this hour a little bit better than the 6 a.m. thing. You know, it's pretty good. This is really an introduction to classification in Paralympic sport. And so if you have questions, I have no problem at all just doing this informally. Like, if you have questions, just speak up, raise your hand, whatever, get my attention. My background, I did my training in Wisconsin. I saw my Badger jacket over here. And so I did med school there. I went out to Seattle for residency, practiced out there for a while, and then went back to Madison for my sports medicine fellowship. And when I was there, I ended up, just because my wife would not disagree with me if I said that I'm obsessed with cross-country skiing, and so pursued an opportunity to be a team doc for an able-bodied professional Nordic ski team that's based in Madison. And through that, the director of that program became interested in Paralympic sport and organized a World Cup race up in northern Wisconsin. And at the same time, they ended up deciding to put on a classification seminar. And he invited me to take part in that, and so I did, and then became a classifier for the IPC, International Paralympic Committee, and have been doing that for the past 4 or 5 years now. For Nordic skiing and biathlon, it's grouped together for that. But that's kind of my background here. And I just want to mention a couple things as far as how I'm going to proceed with this. One is just kind of giving you an overview of what classification is, what Paralympic sport is in general, what classification is, what are the components of that. I know we have a couple people here who are classifiers for athletics, for track and field, and so some of this is going to be reviewed for them. But then at the end, I want to use Nordic skiing just as the sport I'm most familiar with, kind of as a case example of how we go about doing this and what we look at for different aspects of this within Nordic skiing. The good question people ask me a lot is, what is Paralympic sport? You probably all know this, but a lot of people in the lay public are very confused about Special Olympics versus Paralympic sport. I think that's probably the most common in the U.S., common misunderstanding there. We deal with physical impairments, visual impairments. Intellectual impairment is coming back. It was in the games for a while, and then left the games after there was a mass issue with wheelchair basketball and some teams who are not representing themselves correctly. Put it that way. But they're trying to get it back, and there's some things. It's an interesting process that I've talked to some people who are trying to design their ways to classify for intellectual impairment right now. It's definitely not my expertise, but it's an interesting process. So just keep that in your mind, and you'll probably be seeing that coming up more and more. So the International Paralympic Committee really is the overarching governing body for these sports. Obviously, they have national governing bodies for each specific sport at the national level. But these are their kind of vision and mission statements. And really, they're just trying to have a sporting opportunity for people with adaptive athletes. And what is this classification concept? We're going to talk a little bit about the history of what this is and where it came from. But all Paralympic sports have a classification system. And there's a couple things that they're needed for. Some are just basically, are you eligible or not? It's a simple yes/no question. If you're eligible, that's it. That's as far as they go. Other ones have minimum disability criteria. Is your impairment severe enough to qualify you to compete in these competitions? And then for some sports, then you are assigned a sport class, which affects how you compete, who you compete against, what specific races you're in, and or what kind of adjustment to the results are made based on that level of impairment. So the question is, why is this important? Well, first of all, like I said, it says whether or not you can actually run the race or be in the race. For some sports, it determines the team composition. So depending on the level of some impairments, each athlete gets a certain number of points, and you have a max number of points for the team. And so it's a matter of balancing out how impaired each athlete is and stuff like that to make sure that you don't cross this line. And then for a lot of individual sports, athletics, track and field, track, Nordic skiing, alpine skiing, a lot of these ones, they will compete against each other, even though they have different impairments, and then their time is adjusted. For lack of a better word, their time is handicapped and adjusted afterwards. So whoever crosses the finish line first may not actually be the winner of the race. You have to wait until everybody is done, and then you say, hey, who actually won the race? Follow-up with that question is, what's at stake here? I think there's a lot of people would say personal achievement, winning a gold medal or winning a race is certainly a goal for them. With having been to the Paralympics, national pride is huge. Particularly, different countries have different levels of that, but it's a huge thing. And then we don't see it that much in the U.S. At least definitely not in Nordic skiing. I think maybe some other people in other sports have a little bit more, but not very much. But there is a huge issue with monetary compensation for this, particularly in other nations. So, for example, the Russian athletes in Sochi would get 100,000 euro equivalent for winning a gold medal, and the coaches would get that for every gold medal they won. So suddenly, when you start adding this up, there's a huge incentive for winning, and classification can be a huge part of that. So there's actually a lot of discussion about this on the Paralympic teams, at least on the Nordic side. And it can be a very controversial topic, and one that people talk about a lot, even though there's not a lot of control they have over it. But it's something that is a big thing. And when I first started doing this, it really turned my world upside down. It was the first time where you could go up to someone and say, hey man, you can walk. And someone would get really pissed at you and be like, no, I cannot. You know, because if they can't walk, then if they're more impaired, they get a better adjustment to their time. So they want to be the most impaired that they possibly can be. And you're like, whoa, that's totally messes with your head a little bit. But there is a lot of controversy, and a lot of people pushing really want to be classified as the most impaired that they possibly can be. Where did this all come from? Well, it really started back around 1940s when they started having Paralympic Games. And really it started out just with a medical classification system. And this guy's the guy who really started, Dr. Gutmann. And he really just said the same diagnosis, same medical conditions, all athletes with the same medical condition would compete against everybody else with that same medical condition. Okay, so if you're an amputee, all amputees would compete in the same race. All people with spinal cord injuries, they would compete in the same race. All people with cerebral palsy, same race. Okay, regardless of the fact that there can be a vast array of impairment with that same spinal cord injury, high versus low, it's obviously vastly different. Okay, and all sports were the same. It was the same thing for all sports. So initially, it was really designed, I feel, when I start looking at how the classes are put together, and we'll go over at least the Nordic ski classes, so you can see this. It was really started with the spinal cord injury patients, and I think that's where a lot of it is based off of. Eventually, they added amputees, and then VI is visually impaired athletes, blind athletes. CP was then added, and then the other category later on. Like I said, in late 90s, the intellectual impairment were there, and then they were taken away, and now they're starting to be added back in. So then there was a change. There was a change in the early 90s in Barcelona, where they started saying, all right, so this medical classification, that doesn't work. There's too much differences. So let's think about this as far as functional class. If people function the same way, then roughly the same way we'll put them in the same class. So the way that ends up looking is something like this. So you have a double amputee with a low spinal cord injury, roughly the same function. They both have really good trunk function. They're going to be sitting in the wheelchair. They're going to be lumped in the same category, and they're going to compete against each other. So that was the next step. Okay? Then in the early 2000s, we started saying, hey, all right, so let's get a better approach to this again. 2007 was when the kind of the real, I would say, modern classification code was enacted. There's been tweaks to it since then. They continue to update this. There was a recent update where they really were trying to make things, again, more unified approach to classification. Even if the classification system is different per sport, having a unified approach to classification. So that's kind of where we're at now. And what they're trying to do is develop this framework where athletes with with health conditions that lead to impairments that impairment can be taken into account so that the competition is as equal as possible. Okay. And as possible is a big word. I mean, and we'll talk about the limitations at the end too. But we try to group the athletes now into groups where, as closely as possible, their impairment, how it impacts their ability to perform the athletic event is roughly the same. Okay? And so ultimately we're trying to take classification really kind of out of the picture and say, hey, who's trained the best, has the best mental ability to compete in this, and try to get back to that as far as what the competition is about. So here are the things that the classification code in 2007 really started to try to normalize, kind of make it a routine and across all sports. Okay, terminology, some eligibility things, how athletes are evaluated, the procedures, some of the more bureaucratic things of how the process is done, what needs to be presented beforehand. If there's a protest, if someone doesn't agree with you, how does that go about? What happens if there's an appeal? Who does the classification? And then eventually including individual sport-specific classification rules. Okay? And their big push now is to try as much as they can to make these evidence-based. Huge caveat is that there's not a ton of evidence out there. So that can be a sticking point for this. So we've already kind of talked about this. Minimize the impact of the eligible impairment on the outcome of the competition, right? And we're trying to make it as sport-specific as possible. And so because of that, these two things combine to say, how does this affect their athletic ability? Okay? Do they have an eligible impairment, and how does that affect the outcome of competition, and put that together into saying, hey, this is the impact. And one example that I would use would be these two athletes have pretty similar impairments. Okay? It's hard to tell with a swimmer, is it truly above the elbow or below the elbow? Pretend it's below the elbow. But depending on the sport, it affects their ability vastly differently. Okay? A runner is going to be much less impacted by having a above elbow amputation than a swimmer is. So we're trying to take into account too the specific sport and how that impairment affects their activity to do that their ability to do that specific sport. So this is a general approach here. You're going to define try to figure out if they have an eligible impairment. You're going to test that impairment, see if they meet the minimum eligibility criteria, and then group the athletes into sport classes. So that's the three questions, and you'll see this repeated through this, okay? But this is a general thing that we approach. Hey, are they even eligible first? Do they have an impairment that we look at? Do they meet the minimum criteria? And then we can divide them up into their sport classes. So various different sports will have different abilities. Different impairments will affect different sports different ways. So as far as eligible impairments, I have a list here of what generally the eligible impairments are considered. Okay, PI being physical impairment, VI visual impairment, intellectual impairment is II. It's kind of a category of its own. So depending on which sport, you'll have all of these or some of them. So for alpine and Nordic skiing, we don't include short stature as one of our impairments. Could we? Yes, we could. We just don't have it in the rules right now. Okay. We don't include intellectual impairment right now, though there's getting a push to figure out a way to include that in Nordic. One thing that they've talked to me about how they do this is things like for Nordic skiing, the thing they brought up right away was pacing. Pacing is a huge issue apparently for people with intellectual impairments. They don't know so if you're thinking about a 5K or a 10K race, a lot of the intellectually impaired athletes will just go out like sprinting from the get-go, and then they aren't able to learn that pacing thing. So that's very difficult for them. So that was just one example that was given to me of how it would affect Nordic skiing, where otherwise you're like, oh, Nordic skiing, it's just get in the track and go, right? So anyway, that was the example that was given to me. So there is a policy for these. We want to verify the eligible impairment, whether or not it is. We do this by looking at past records. We do it by including a physical exam at the time. A lot of times for just whether or not they have an eligible impairment, you can do a lot of that just based off of medical records. So oftentimes we will get questions saying, hey, should we even bring this athlete to a classification event? You can say, oh, no, because X, Y, Z, or yes. And so then we can say, hey, do they meet the actual minimum criteria later on? Which brings us to the minimum disability criteria. So is the eligible impairment severe enough to affect their ability to perform the chosen activity? Okay, so for alpine skiing, they have to have a limb deficiency below the elbow. Okay, so it can be anywhere below here. Okay, it has to be there. In Nordic skiing, we define it a little bit more tightly, saying, hey, they can have, if they have enough fingers and ability to grip a ski pole, then they are not eligible. Okay, but if they don't, it's basically a club hand, then they are eligible. So it gets kind of tricky sometimes, depending on how much function they actually have with their hand to functionally grip a ski pole. And there have been times when people have showed up to classification events, and I've had to tell them, you are not eligible, for this. Either you don't have a qualifying condition, or your impairment is not severe enough to qualify for this. And that's a tough conversation sometimes to have, because they show up, they have often traveled a long ways, and they show up. I remember this conversation with this Canadian girl who had Perthes, and it was very difficult for her, because she's like, no, I can't do what my friends can do. So that's absolutely right. And I can encourage you to continue to participate in sports. I think it's great for long-term health and stuff, but the level of impairment that you have with this injury, with this illness, is not enough to qualify for this competition. So we have that at times. Then the final step is to divide people into, to assign them a sport class. And this is based on the activity limitation, like I said, how it affects the specific sport that they're trying to compete in. So using Nordic skiing as an example, we're going to kind of go through this, okay, and kind of walk you through the process as I view it from the beginning. So first of all, how do you approach athletes with impairments? I think you guys are probably much more comfortable with this than other specialties are. But in general, we try to make this as less invasive as possible, least invasive as possible. We're trying to reduce discussion amongst classifiers. It's really easy to want to get that curbside consult and say, hey, what do you think? But at the same time, especially if there's issues with protests and you want to keep the other panel unbiased, you kind of want to keep it amongst yourself. Each panel is, at least in Nordic skiing, is two classifiers. You want to make it not stressful for them. They're there at a race. They may be at a very important race. And so they're already stressed about that. Adding more stress on top of it is not necessarily what we want to do. And we want to watch them as much as possible in as much settings as possible. There are cases where people will not give their best effort when they're in the classification room. Okay? And for Nordic skiing, we have two components of classification. We have one in an exam room, which can be as simple as a hotel conference room. And then we observe them on snow as well to see what they're actually doing when they're out there. And it depends, and it can vary. I think just learning how to approach athletes is an important thing too, and so I include this particularly when I give talks to other groups as far as how do you approach them. And I think this is a good kind of reminder of how to make sure that you approach them that way. So like I said, this is generally the approach. Eligible impairment, followed by impairment severe enough, doesn't meet the minimum disability criteria, minimum eligibility criteria, and then what specific class do they compete in. So for Nordic skiing, one thing, and this relates a little bit to that kid with Perthes, the impairment has to be permanent. So if you aren't sure how it's going to go, you aren't sure, so her age was a little bit older. She had acquired it at a little bit older age as well, and she was, I think at the time of classification, she was like 16. So she was still going to have some significant impairment. We didn't know where it was going to be at that time, and for a lot of people, say she had come in at 12 years old, well then she might completely resolve. She might not have any issues, so she would not be eligible just based on that. Okay, so it has to be permanent. It has to be one of the 7 things that we mentioned before as far as the things that Nordic skiing will consider. It has to be measurable. Right now we said intellectual impairment is not acceptable, and pain is an important one that has caught some people in the past, some of the classifiers in the past, because someone says, oh, I can't do that, and they can't do it because it hurts too much. Pain is not an eligible impairment. Okay, and that sometimes be a little bit difficult to tease out, but if they can't do something, they can't stand up because it hurts too much, just hurt too much, but there's no mechanical reason why they can't. And then we look at generally standing athletes versus sitting athletes. Okay, that's our next thing, and depending on which direction they're going, what their impairment is, we're going to do different things. Okay, so if they have a limb deficiency, we're going to measure it. We're going to measure the range of motion, manual muscle testing, range of motion testing. If it's more of a issue of a neurologic deficit, then we're going to do more like coordination testing, tone testing, Ashworth score. If it's more of a sit skier, then we have some things to test as far as trunk function, balance out with their trunk, and in addition to just strength and ability to fire those muscles, sensation as well. So physical assessment, very similar to other things. Inspection, palpation, range of motion. Radiographs are really important. We require everybody to bring radiographs in, or studies that they have, whether it's plain studies or MRI. I think it's also important not to assume that someone, because they have a spinal cord injury at T8, then you know what it is, and the exam is done. You really need to examine people if there's very incomplete spinal cord injury, stuff like that, where people can have different levels of function. So it's really important to continue to do that. We use, for manual muscle testing, we use the Oxford scale. We do a kind of a modified thing from Daniel and Worthington. The big question that we get into is if someone doesn't have, with this manual muscle testing, if you look at it, it's like, all right, so it's through the full range of motion. Well, how do you define full range of motion? Is it the full normal range of motion, or is it within the range of motion that this person has? A lot of times what we end up doing is doing the motor testing at the mid-range of function, the midpoint of their range of motion that they have. Okay, it's trying to be as accurate as we can be. And I think the big thing for us is that we want to be fair. We want to get the people in the right category. We also want to be really consistent. So as far as classifiers go, so that they know if they go and see one classification panel, they're going to get the same result if they see a different classification panel, just as far as developing trust in this whole system. Because if one person says one thing and then they turn around and go see another official and they give you something else, and they're like, what is this? There's already enough issues with trust going on anyway. So if we can somehow make sure that everybody says it would answer it the same way and we're well trained, that's going to take a lot of the issue, potentially take a lot of the issue away, or at least start building the blocks of more trust within the sport of the classification process and trying to be transparent that way. For spinal cord injuries, we use the Asia classification. Literally, we take this form, and run through it, test the different dermatomes, figure out what they have, what muscle strength they have at each location to figure out where they're at. Coordination tests, these are just some of the ones that we use. These are the primary ones we use, depending whether it's upper extremity or lower extremity. Like I said, very aware of these ones, but these are the ones that we typically use. Spasticity, we use the Ashworth scale for spasticity, and depending on the level of spasticity, the grade of spasticity depends on whether or not they meet the criteria and how much they is. For Nordic skiing, we use this as well. This is kind of a special test for us that was developed by one of our classifiers. It's called the test table test. Very creative name. It gets a little bit confusing, actually. Initially, when they first designed this, this was a non-flat end plate. It was a curved end plate, and so it was a rocker board, which I just think is, having gotten on one, is crazy difficult. You have to have a lot of core stability to even not just fall over. But we've gone to now, she's validated this with a stable end here. We strap them in. This is trying to just create a normalized situation, normalized environment to do tests off of. There's some people have argued to say, hey, why don't we have them bring in the sit ski if they're going to be sit ski athletes, and to let them do it in their own sit ski. But then you're testing it. You're not having a control situation to compare athletes to. So in this case, you strap them across the knee, across the ankle, across the hips, and then you ask them to do 3 tests. This first test is just see how far forward they can flex, hold it for 5 seconds, and then see if they can come back up. Okay, it's a test of kind of spinal extensor activity, okay, and control that way. The next one is how far back can they go, hold it for 5 seconds, and then be able to bring themselves back to the neutral position. So can they get out of their base of support and bring themselves back in? For skiing, for Nordic skiing, this has a big implication, particularly with bending forward, because someone might be able to bend forward and get all the power into the poles, like this. When we go through the different classes, you'll see what I mean and why this is important. The third test, actually there are 4 tests, I'm sorry, there are 3 tests, 4 tests. The third one is turning side to side, so having the arms out like this, and then just twisting. It's kind of a rotation thing. A lot of people with higher spinal cord injury, they'll do a thing where they kind of squat down. I don't know if you've seen that. It gives them a little more stability. They kind of do a sacral sitting on their sacrum as opposed to sitting on the ischial tuberosities. Gives them a little more stability. But a lot of people with really high spinal cord injury, they cannot support themselves this way. They'll just. So it's a good way of, again, of seeing what kind of control they have. And the final test is to pick up a medicine ball or a 1 kilo, 2-pound weight, and transfer it from one side up over the head and down to the other, and then move it back over on this way. So it's giving you a little bit more torque in terms of being able to complete this task. And then depending on what the score is for each one of these tasks, you get a general number, and then this general number helps you identify which sport class they're in. Now the thing with sport classes is that, especially with sit skiing, there's always going to be a range. You know, like some people are going to be some people are going to be at the high end of the range, and some people are going to be at the low end of the same class. And so there's nothing that says specifically like, oh, hey, if you have a score of 11, you're going to be a class 11.5. It's a kind of a best fit situation. You're saying, hey, we're going to take that into account. We're going to take your motor testing into account. You're going to take your coordination into account. And we're going to see kind of where you fit best. Because if you say you need to fit all these criteria, when we get into the sport class criteria, you'll see there will be really easy ways to argue, hey, I have one of these in class 10.5, and I have 4 in class 11 and 1 in class 11.5. Well, if it says I need to meet all these criteria, well, yeah, then I need to be in whichever is most disabled. Or if one of them falls into the most disabled, I'm going to be in that class. These are other assessments that we can sometimes use, particularly if they're in the wheelchair. If few cases now we're getting much better about having the test table test there at every classification. There have been a couple times when they haven't had one there, and we've had to get kind of creative about trying to duplicate that as best we can. On snow, there's different things we look at, and we've created this, what we call a technical observation form, that helps. And again, it's not anything, there's no one defining thing like, hey, if you can ski this way, if you can be in this position, you are therefore in this class. It's kind of like, hey, put all these things together. And this is where these sitting positions, it actually does hold true as far as the lower classes, LW10s, LW 10.5, 11, is 10 through 12 are the sitting classes. They're the ones with the higher spinal cord injuries, so less function of their core muscles. They tend to sit with their knees higher, and it's for that reason that I was talking about before, which is if you're pulling forward, which is the motion in Nordic skiing, spinal cord, your core muscles strong enough to keep you upright. You need something to basically act as a buttress. So they tend to sit with their knees high, so their knees act as a buttress. Bouncing off their knees. And then they have a high back sled. And so then it keeps them from falling backwards. So it gives them more stability by going up. But you get more power, the more lower you can get your knees, because then you can body weight falling forward onto the poles and go. And so the higher functioning classes tend to be sitting now more and more, getting into this, more of kind of a wheelchair racing position with the knees tucked back underneath them. Some other things that we look at, how they propulse. Do they use their core muscles? Are they just using their arms? Are they able to get their trunk out of vertical? So if you think about cornering, if you can only sit vertically, if you're going around a corner, you're going to be thrown out to the outside. Can they get low and get their trunk over? Okay. Do they use their head? A lot of times they'll try to lead with their head just because they can use their neck, so they'll try to get the momentum by throwing their head back and forth to try to get the momentum to carry the trunk forward and back. Balance or stability on downhill corners, being able to hold that edge, getting the ski, so a sit ski is rigidly attached to 2 skis like this, okay, and you can only really go straight unless you kind of hop the ski around, okay? You can carve the skis, same thing like carving downhill skis, but in order to do so, you have to get the ski up on one edge. Higher functioning athletes can get that ski up on one edge, and so then they can carve the turn more, okay, as opposed to having to just basically pivot themselves by using the poles one behind, one in front. Think about like turning a kayak. That's another way to turn. Okay, so which way? How can they turn? How can they turn on corners? So they need to slow themselves down because they can't lean into the corner and keep the center of mass in such a way so they don't tip over to the outside. So these are all things that we kind of look at as we look at them, particularly on the snow. We also try to evaluate them in races so that at their first race, that's a much better time to see if they're giving their full effort. You know, we have an opportunity to kind of revise our assessment of them depending on how they show, what they do. Another big one that we started to see is whether or not people, if they're in there, like I said, in order to turn, a lot of times you have to kind of hop the ski over. Are they able to lean back and pull the front of their skis up? That's another one that we start looking for. Then specifically, how does this translate into skiing? So I'm just going to kind of go over what the sport classes are, and I think you'll start seeing how this works. Okay, so for visual impairment, there's three different classes, and the big thing with these is that for these ones, depending on the class, their time is adjusted. Okay, based on what class they are. So B1, no vision at all, it's black. And in fact, athletes who compete in B1, they have to wear goggles that are completely opaque, so they can't see out of it. So even if they have some residual sight, it's taken away from them for the purposes of the competition. Everybody can ski with a guide. B1s have to ski with a guide. B2s and B3s, they can have a guide or they don't have to have a guide. So there is a Canadian skier, probably arguably one of the best blind skiers probably for the past decade, who made the Canadian able-bodied, non-adaptive Olympic team for 2010. He ended up not skiing there just because of who was sick as far as which race he did. So he does not need a guide. He skis better if there's a guide, and he skis fast enough that they actually bring in the Canadian able-bodied World Cup skiers to be his guides. For longer races, they bring in two because he will exhaust one. That guy will bail out. He'll ski by himself for about a K, and another guy will jump on the course in front of him, and then he carries on. Okay, so it's beneficial for him. I mean, if you look at this in this situation, he drafts off of them. So it's actually a beneficial thing. Not only does he not have to think as much about the course, even though he has some vision, some residual vision left, there's some strategic things that are good for him to do that. But so B2 has some sight, and it's not as good. And I have my next slide will actually show you this. I don't do any VI classification. This is optometrists, ophthalmologists who do the VI classification, and they do it at an eye clinic basically. So but this was an interesting slide when I first saw it, just because there's times when I was like, what does this exactly look like? So this is a good example of how you can have different levels of vision impairment. So this person has some limitation of their field of vision, a little bit of blurriness right in the center, but it has pretty good vision in there, okay, around it. So this person could ski by themselves. It affects as far as, particularly as you start getting faster, and being able to pick out fine points in the trail and stuff like that as you're going faster. If you have blurred vision, it definitely impacts you more. But you can see then you have people with more limited field of vision, and how that could potentially affect you if you're trying to do sport skiing at times as a speed sport. As far as standing classes go, standing classes, from my perspective, is not so much of an issue of which class they go into. Generally, it's easier to determine which class they go on to. The big thing with standing classes, I think that's still not really adequately addressed is what percentage to give their time. Okay, how much does that impairment actually affect their time? Okay, it's pretty clear in most of these. For skiing, and when I talk about the time adjustment, the percentage of the time, I don't know how many of you are really familiar with Nordic skiing, but I'm just going to put this up here. Bear with me. Nordic skiing is a little bit like swimming, okay? Swimming, there's 4 strokes, all right? There's freestyle, or front crawl, breaststroke, backstroke, butterfly, okay? Each one is different races. You do them, they're all swimming, but they're different races, okay? Skiing, Nordic skiing there's 2 techniques, if you will, okay? There's classic and there's skating. And they're different demands depending on which technique you're doing. So classic skiing tends to demand more upper body. Skating, and this is classic skiing. This is what traditionally most people think of with cross-country skiing. Same kind of walking motion, opposite arm, opposite leg, going together like that. Sometimes you'll do double pulling where your feet stay together, but you're just pulling like this. In fact, more and more races are only being double pulled by people because they're just getting stronger and stronger and realizing that's a really fast way to do it. So this is classic. Uses more upper body strength because the push that you get is just based off of friction and bonding between the kick wax, which can only grip so much going forward. So you end up getting a lot more of your propulsion from your arms. Okay, so people with upper extremity deficiencies are going to be more affected in classic skiing than, say, skate. Skate skiing is more like speed skating. Okay, your pull is definitely for propulsion. It's typically almost always just a double pull, both pulls at the same time, but it's a side-to-side type thing. And you get low, it's very much more dominated by leg power. You're still getting most of your propulsion from your upper body, but you're getting a lot more from your legs than you are in classic skiing. Okay, so lower limb deficiency or impairments are going to affect skate skiing disproportionately more than classic skiing. Okay, so think about that as we go through these different classes. So LW2, so this athlete here is a above knee amputee. Okay, a lot of LW2s, they can actually choose whether or not to be a sit skier or a standing skier. A lot of them will choose to be a sit skier just because it's so difficult to ski with not having that kind of control with some below knee amputees will choose to be standing skiers. We'll see some that are standing skiers. The other thing is that if you have no range of motion at the knee, so it's basically a completely straight knee, straight leg, that falls into this category too. So basically, if LW2, think of it being affecting the whole leg. One whole leg is affected from the hip down. Okay? So for classic, this people will get a 92. Their time is divided by 92%, so or is multiplied by 92, so their time drops. So they get it that way. Freestyle is 91%. Okay, it affects skate freestyle more than it does in classic. LW3 is if it's both legs. This guy actually, he had a bilateral lower extremity CP. He had issues with coordination of both legs. And sometimes there are issues where they can't ski one technique. So if they cannot bring their legs so that their legs are straight, it's really hard for them to ski a classic where they're ski. Some, they'll ski everything. They either won't enter the classic race, or they can only enter skate. Or there's some people who can't turn their feet out in order to skate sideways. Classic, but their time adjustment is still only based off of this. That's a current topic of, hey, do we need to rethink this? Do we need to have people have different classes depending on what technique the race is in? So that's something that is currently being discussed. LW4 is a below knee issue, so a lower leg issue. You can see that their percentages are even higher. Higher leg is affected. Typically, these are below knee amputations. They have some issue with muscle power, loss of control of that one leg, or a leg length discrepancy. There's no great data for the leg length discrepancy. We've had a lot of talks about that one too, because about skiing. There's some with running, as far as efficiency goes, but those ones tends to be around, 2.5 centimeters impacts your efficiency of movement. Why did they pick 7? It was kind of a little bit like, hey, at least it covers everything, and we can go. Trying to adapt what information we had, to say, hey, we can go there. So some of the studies there are only a few studies out there, but it was somewhere like 5 centimeters affected them, somewhere 2.5 centimeters affected them. The rules were always 7 centimeters. I don't know where that came up with, but I was at a meeting where we were trying to decide this and looking through literature, trying to be like, where's the evidence? What evidence do we have? Well, this is the best we have. And I think there's something where right now, the chief medical officer of the Paralympics is really, really, in a good way, wants to be evidence-based, but he's also not willing to accept expert opinion as a level of evidence. Even if it's support, the lowest level of evidence, it might be the best we have. So there's some things that are frustrating right now because they aren't making the moves. The changes that a lot of the classifiers are like, this is just obviously not fair. We need to change this. But until we get evidence, then it's a difficult thing to say. So LW4 5-7 is bilateral upper limb involvement, and this is another one that currently they're really looking at to say, hey, is this fair? An example of this would be a situation where you can kind of see these. One person really has full limbs but can't grip a pole, can't grip poles, versus someone in the very bottom who has no limbs at all. Okay, and the way to think about this and how this affects is that if you have your limbs there, but you can't grip, but otherwise they're functional, you can get a lot of momentum and a lot of power. Think about speed skating by the arm swing. Okay? So this person on the top probably has a pretty good advantage over the guy, the Japanese skier on the bottom, who has no limbs, can't get any momentum. Carry their center of mass over that way, and that's the way you can carry a lot of your momentum. But right now, these are all classified in the same thing. Theoretically, we'd have 3 distinct categories. One where it's, below elbow on both sides, one above elbow on both sides, and one below elbow and one above elbow. Divide up how many combinations can you have of that. So that's what we'd like to see. That one is being discussed. Hopefully we'll see that change come about. I should also say that the way that they've gotten these percentages, which is actually really where a lot of the controversy is about, was really looking at results, trying to normally distribute people with different abilities in the top 10. It's all statistics. Literally, the chief timer of Nordic skiing every year looks at this and says, hey, do we need to adjust the percentages based on where people are ending? Okay? So it's not evidence-based this way. This would be one that I talked with the director of the Nordic program, the U.S. Nordic program, and he actually had a study design all done. He was talking with the guys. He's based in Utah. And they were going to set up people where they got non-adaptive athletes who are very competent because they're going to do this roller skiing, and strap their arms in different ways to say what effect does it have on their time in doing time trials. Like every couple weeks, have them come back. One time strap their arms together like this. One time strap their arm up like this. One time let their arms out, but not be able to use poles and see what the time is. And then if you had enough people that way, maybe we could get a better idea of, hey, how does this actually affect the efficiency of movement and their ability to do this. LW6 is a unilateral upper limb, entire upper limb involvement. LW8 is below the elbow. LW9 is another one that's really tough because this incorporates people who have both upper and lower limb involvement, and there's such a huge range in this as far as what kind of impairments they can have that they end up, we rarely see them get podium spots because their impairment doesn't match with what their percentage is. So this is another one it's a huge, hey, you have an impairment that's eligible. You have both upper and lower, but that's as far as we're going. Okay, you have upper and lower, you're LW9, we're out. That's one that I think eventually we need to start really looking at too to figure out a better way of doing it. Sitting classes, like I said, it is really started from spinal cord injury, and the interesting thing with classification is that we're starting to see so many more and so many new impairments out there that we don't know what to do with, and so we're trying to figure out ways to fit them into this current classification system. And when I talk about the limitations at the very end, I have a couple examples of what that is. But this is in general the thing that we're talking about, and I'll go through these first, and then we'll talk about more what the limitations are. So LW10 is the most affected. They really can't sit unsupported at all. They'll topple over. These are specific things, but they tend to sit in this kind of knee-high position. LW 10.5 still often will have a knee-high position like this. Then there's exceptions to all these. You can find some people who are like class 11 who are knees way down, and it's kind of baffling, and we're like, oh, let's revisit this, and they've been reclassified a number of times, and they're still in that category. But in general, these are the ways to go. LW11s, traditionally in the past, typically have their legs out in front. I think more and more they're trying to go into this feet underneath position. LW 11.5, pretty good trunk control, maybe a little bit of problems with that. LW 11.5 versus LW 11, one big thing is that LW 11.5s can walk. And so if someone comes to me, and we've had this case before, being like, hey, this athlete got classified as an 11, but they can walk with crutches, they're classified wrong. Okay, so this is a key point between these two, is that 11.5 can walk with aid, 11s cannot. Okay? 12s, classic example of a 12 is completely normal trunk function, so bilateral double leg amputee, really low spinal cord injury can fall into this one as well. This is for sit classes, this is your 100% time. They don't get their time adjusted. They just get their time as is. But when you start thinking about limitations, I kind of mentioned some of these already. Really, I think there's a couple of these. And the first one is trying to be consistent. I think it is a really controversial topic. People have a lot of invested in it because this can mean whether or not they win or lose. And I think there's a lot of trust issues between the athletes and the coaches and the classifiers. And you find, I don't know, Jerry, if you have found this in the past for you, but in Nordic skiing, it can be really kind of a antagonistic relationship between the athletes, the national teams, and the classifiers. Not because the classifiers intended to, it's just because there's a lot of lack of trust, and hey, that doesn't make sense. We see this person doing something, and how come they can do something and I can't? Or how come they can do this certain activity and my athlete can't? Then you get into the whole question of fairness. Is this fair? Like I said, LW9s who have both legs and both arms affected, upper and lower extremities, is that fair that they're all lumped in the same one? Well, arguably not. I think the trick is that a lot of times people will, in a best case scenario, you would compete with only people who are exactly the same impairment as you. And that's really hard, and I don't think it's ever going to be achievable. The analogy I use is that it would be great if I, as a non-adaptive athlete, we could have races based off of VO2 max. Now, I'm only going to compete against people in the VO2 max in, say, 60. That would be great. I would love it. It would put technique in there. It would put, mental ability in there, But no, as it is now, I have to, we compete against pro race. There's people who have VO2 maxes of 90 and some who have 70, and you don't know who's going to win the race. You have certainly one person has that way. No, I mean if you want to compete with other people, at some point you're going to have to say there's going to, unless we have individual sport classes and you're all just competing against each other, against yourself, you're going to have to. There's going to be some people who are at the top of a category and some who are at the bottom of a category. So is it going to be ideally completely fair? Probably not. But in the spirit of competition, is that okay? For me, I'm like, yes, we're going to do the best we can. We try to classify people the best we can. Are we consistent? That's the thing that I'm more interested in, really. Knowing that we aren't going to ever be completely fair. The other thing, like I said, with this is that, particularly with sit skiing, it's based off of spinal cord injuries, which are not including now various things that we're seeing now that probably we weren't seeing a lot of. Some of this is related to congenital. That's just grew up and maybe didn't think about participating in sports, so now they are. I think there's stuff with vets who now we're seeing are surviving injuries that they not used to. Cancer patients who are now at the same time, our classification system is not necessarily really well set up for it. Okay, so one example is are these two athletes on the top who both have a hemipelvis. They're missing part of their pelvis. They're missing one leg entirely. And their ability is very, very vastly different. The one on the left is a Canadian swimmer, a well-decorated Canadian swimmer who then came and transitioned into Nordic skiing, congenitally missing her pelvis. It is amazing to see what she can do because if you stabilize her leg, she can do a complete sit-up where she goes all the way down, holds it there, and comes back up completely straight. Whereas if you see this other athlete who had a sarcoma as an adult and lost part of his pelvis and lost his leg that way, he has a lot of issues because his muscle balance is asymmetric. And so if he falls one way, he tends to fall one way. He tends not to fall the other way. But once he falls down, he has a really hard time getting back up. Okay, so I think there's a big difference between congenital versus acquired, and I think there's a big thing that we don't take into account, which is asymmetries at all, at least in the Nordic skiing biathlon classification system. Another thing is that we see stuff all the time. The first time I ever was at a classification event, we kind of were they're giving us all these cases, and we're learning off, in the classroom, in a room like this. Okay, so what do you think this person would be? What do you think this person would be? So, given what you guys know about sit skiers and level of impairment and how this goes, where do you think this case would be? And they said, and they kind of chuckled about it, being like, we've never seen this. So, bilateral hip disarticulation, like their core is totally fine, but they have no legs. Where would they fit in this? Like, well, it seems like the full core would be a LW12, but one of the things that you think about is cross-hip communication. Like, do they have muscles that connect below the hip so they have something to, like a lever arm, to stabilize themselves off of? And we're like, we kind of hemmed and hawed and came up with something. Literally the next day, we're doing the actual classification and enrolls this Canadian athlete, congenitally, no femurs. Amazingly fit guy. But we then had to be like, where do we actually put this guy? Like, where do we see him? And we classified him. And now when we look back at this, we actually classified him very, very incorrectly. And we want to revisit this to put him in a better one, because he is classified currently as an LW12. But he cannot get out of his base of support. If you trying to have him do that test table test, there's nothing to strap down. If he leans forward, he's tips over. He has incredible core control. Like, he can hop his ski all around, but he has to be strapped in a way, and there's only so much he can do in order to lean forward. So he can kind of do a really good upper body crunch, but he can't lean forward. That's another situation where it's not in the rules. What do we do with this? Okay. Another one that I wasn't even aware of until I was interviewing for this job 3.5 years ago. And I was talking with some of the orthopedists over at Children's, and they're like, oh, you're involved with adaptive sports. I got to tell you about this. So they started talking to me about this rotation plasty, and I was like, I've never heard of this. What is this? So it's a procedure where if they have a around the knee sarcoma or there's cancer there, they can take out the knee, attach the ankle there, but reverse it. So they have a joint. So basically they're kind of in between an above knee and a below knee amputee. Well, where would this person fit into this classification scheme? They have control over a lower extremity, but is it the same? Is it going to be the same as a below knee amputee? Really, I don't know. I mean, Jerry, are you involved with those gait studies that they're doing? I know Travis over there is doing some studies in the gait. Right, yeah, he's the athletics. So it's going to be an interesting case, I think, when we see the first one come through to say, hey, where does this person go? Yeah. 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 Right. Yeah. Yeah. I think it's really interesting, to look and try to figure it out. So that's the fun part about classification is that seriously, every time, intellectually, it's super exciting because when you go to these things, you never know who's going to walk in the door, or what they have and how they fit into this really rigid structure right now, and how are you going to allow them to compete if they're able to. So it's a fascinating process. I highly encourage you guys to try to get involved with it. Certainly, as far as evidence-based, there's a huge need for it. So if you're interested in research in sports and combining sports and adaptive sports, I think there's a lot of room for this. I think there's issues with funding and stuff because the numbers are low, and you'll have to figure out a way to do that. So I think that's part of the challenges of working with the population. Any questions on all that stuff? They would have the option to be. They could choose to be. Here's the next thing. So if someone can be a sit skier, there's certain sit skiers. So there would be an LW12. Granted, okay. And there's some people who are in LW12 who say it's a disadvantage because if they're sit skiing and they have legs, they're at a disadvantage compared to the ones who have above knee amputations because there's less weight that other people are carrying. What do you do with that? I don't know. Some people are like, cut it off farther. Just leave me this little stump. Yeah. Right, totally. You should. You know, some sort of equalization thing. Like, yeah, you can be in that class. You have to have this. But there's the question. I mean, this is the thing too, where the question was like that kid with Perthes. She wanted to be a sit skier, and the argument from the Canadian coach was like, she's not going to be at any advantage. Like, we should let able-bodied people, you know, non-adaptive athletes, if they want to compete in a sit ski, go for it. You know, none of us are going to have the adaptations yet to be able to compete well in that. But should we be allowed to? Arguably, sure. I mean, I agree with that too. But that's an argument that's been put forth. Anyway, it's intellectually, I think, like I said, I think it's a fascinating area, you know, and from a medical, like, just problem solving and assessment and trying to keep the ideas of fair sport in place and what competition is about, you know, and I think it kind of brings a lot of these things together. In non-adaptive sports? Adaptive sport, there's really only one place that's doing it, and it's a group that the IPC has really gotten on track with, and they're having a lot of trouble finding funding for it. But it's a group that's done a ton of non-adaptive ski research. A couple guys, one in Austria, a couple that are now based up in Finland. But then there's two groups, one in Sweden and one in Norway. A ton of research on biomechanics and ski technique. You try to adapt that as much, you know, try to apply it as best you can. Trying to take, like, a lot of things with athletics down in Australia where they're more recognition that trying to, even if it's not Nordic skiing, you can look at the effect of, again, the arm length is on running stride. Can we start looking at that and applying it? They have kind of centers for research, and one is in Australia, one up in Finland for Nordic skiing. Outpacing what other classes. By putting the power into bending them, or you get does, because some teams show up with sleds that are all carbon fiber and super aerodynamic, and there's some teams that are just struggling. Similar debate is in all sport is like altitude. Has considered in the past whether to make altitude tents. And the question is, okay, so I don't have answers for you. I just said it's how exactly would you? Yeah, totally. Yeah. If you ever get a chance, you might be interested in this too. Ethicist, a bioethicist out of kind of turns things on its head, but from an it may not be in the spirit of competition, you know, and fairness, but if you ever get a chance to hear that talk, you might be able to find it even online, but it's a fascinating one that you're kind of. Right, exactly. Whole nother realm. There are technical rules in I skied all over the place in Madison. I mean, Albert Park was great because it had lights, you know, so you could just go out there 8 p.m. and